This is Talk to KEDI, sharing knowledge, liberating mind. Hello there. Thank you so much for joining me on another exciting edition of your #1 educational online broadcast, Talk to KEDI. Our topic of today is gastroenteritis, causes, prevention, and treatment. In other words, we'll be discussing what gastroenteritis is, its causes, people who are susceptible to this ailment, and treatment, and the effective preventive measures for this ailment. My name is Felix Adeyemi. Welcome on board and get ready to learn. With me in the studio today is one of our top leaders. He is an honorary lecturer, the owner of Service Center 294, located in Lagos. He is a highly knowledgeable TCM Consultant. Please join me in giving a warm welcome to our amiable Mr. KEHINDE Adeyemi, popularly known as Kenny KEDI. Welcome to Talk to KEDI, sir.
Good morning, my brother. Good afternoon, my brother.
Good afternoon, sir. Could you please introduce yourself to our viewers?
My name is Adeyemi Kennedy, as he has already said. I'm a TCM consultant in Lagos. I'm based around the Jokoro. Wow. And I've been with the company for almost 18 years.
Wow. Welcome to Talk to KEDI, sir. Thank you so much, and we are delighted to have you once again in the show. In case you're tuning in for the first time, this is Talk to KEDI, your #1 educative online broadcast, brought to you by KEDI Healthcare Industries Nigeria Limited. We are the leading provider of quality healthcare products and services nationwide. Welcome on board and stay tuned. Today, we are diving into an important yet common health concern that affects millions of people worldwide: gastroenteritis, also known as stomach flu. According to experts, nearly 40 to 60% of the world population experience some form of gastroenteritis annually. Also, recent research shows us that gastroenteritis is responsible for over 1.3 million deaths globally every year. This is indeed a serious health concern. Stay tuned and let us dissect this topic today. Stay tuned with us. Let's get ready to learn as we dissect the symptoms, causes, prevention, and treatment of this deadly disease to help you stay informed and protected, while also answering all your concerns about maintaining a healthy digestive system. Don't forget, you can be part of this conversation in the comment section. Now is the perfect time for you to send in your questions. Share the link to everybody that you know and invite them to join us in learning about gastroenteritis, the causes, prevention, and the treatment. Over to Mr. KEHINDE Adeyemi as he takes us through gastroenteritis, its causes, prevention, and the treatment. Sir, are you ready?
100%.
All right. Our first question is this, sir. Sir, what exactly is gastroenteritis and how does it affect the body?
Gastroenteritis is also known as a stomach flu. It's an inflammation of the intestine.
Yes.
Basically, let me say an infection of intestine. You know, when we are talking about intestine, we have stomach, we have a large intestine, we have a small intestine.
Yes.
But the principal organ that is affected is small intestine.
The small intestine.
Yeah. And it do affect the system in a lot of ways. It has basically 4 ways that normally affect the system. Occasionally, you can be having a diarrhea, that is running stool, mostly watery. When it's now becoming bloody, then there is something bigger than gastroenteritis.
Oh, wow.
You understand?
Yes, sir.
Then nausea, stomach cramps, then little fever. Then vomiting is also part of it.
Wow.
That's how it normally.
So this is how it affects the body system. All right, that takes me to my next question. Having known what it is and how it affects the body system, what are the most common types of gastroenteritis? Kindly explain to us the causes of each of this type, whether it is virus, it is bacteria, or other factors. Just explain to us the causes of each of these types.
Basically, two major types. There is one called norovirus type.
Yes.
There's another one called rotavirus type. The rotavirus type is dealing with children, the infants, the teenagers, and they are the most susceptible challenge to this particular problem.
So the children are the most susceptible ones.
Exactly. You understand?
Yes,
so, and if they contacted this particular virus, the incubation period is within 3 to 4 days.
3 to 4
before
days.
it manifested.
Wow.
You understand?
Yes.
But norovirus, that's one is the virus that deal with the adult's own.
Okay.
That one is within 12 hours to 48 hours of contact that you
contacting this particular virus.
Something that is not part of your system.
Yes.
You understand? So there's another one that you can contact it through food poisoning. That's a bacteria. That's one bacteria that always causes
gastroenteritis.
Yes, causes gastroenteritis. Salmonella food poisoning.
Yes, salmonella.
Then Giardia. Those are the ones that are very common through the food poisoning. Okay. You understand? And the major challenges that made this thing happen is our poor hygienic nature that cause this in most of the time.
So for most of us that will go to restaurants, we go to so many history, with mama put and every other thing, we are prone, as an adult, we are prone to probably getting contacted with this bacteria gastroenteritis.
That is it. You know, the challenge mostly is normally happen through the what they call fecal oral cord. You understand? When somebody come in contact with an infected person's stool, due to our poor hygienic nature, most of us normally go to toilets, come out from it, won't wash your hands, just start picking another thing. Those things you touch, they might have been infected with that virus. Then, or if you come in contact with that person's vomiting, maybe when the person is vomiting, you pass, and it's one of those things that now splash onto your cloth or your hand. While you are saying sorry, all this kind of a thing. Before you know what is going on, you have already picked part of those challenges. Wow. I have an incident that I occurred like that during this outbreak of cholera recently.
Yes.
I was contacted for a consultation from my friend, and I was looking for the solution to that consultation. Yes. Understand? I moved to that particular day. I went to Anke at Ikeja and some other labs because I need that information so that I can submit my findings to the person. And I went to a particular lab around Okyodo, one very particular lab around Okyodo. What I noticed there was that I put my hand on their counter. And that's the only place I did that. By the time I got back home, in the lab, by the time I got back home, I didn't get myself. Because along the line, I received call. Yes. I bought bottled water on the road. Contact, but the contact. So from the way I was doing that, maybe one of those I've injected it. But within 24 hours, I was just running stool. My wife asking, what I'm suspecting present now, this is cholera. And I didn't eat anything because I don't normally eat outside. And I said, where did you went to? And I have to trace my foot back. Exactly. And I realized that this is the only place I placed my hand on the counter. Maybe one of those who came in for the lab test. Yes, must have been a carrier and now drop it. Do you know how many people will also pick it that day? A lot of persons have picked this pathogen. Wow. So we have to be very careful. Since that time, I've cultivated an habit. Anytime I'm coming home from anywhere, I will walk straight to the toilet, wash my hands. I guess this brings us to our next topic. It's like, I would like you to now shed more light on it. The next topic is about how does each type of this type of gastroenteritis spread? How do they spread? What are the key symptoms of each and every one of them? What are the key symptoms and who is at risk? I remember the last time you said children. Children are greatly at risk. They are the most principal culprit. Okay. Well, now let's talk about it in detail, sir. You know, children doesn't understand the word no. when they are associating with their friends.
Yes. They just want to play with their
They just want
friends.
to
They
play.
just want to
And
mingle.
when you are saying they should not do something, we want to know why you say they should not do it. And what you say they should not do is what is more paramount in their
Of
heart.
course.
Don't collect this thing. Don't touch this thing.
Mm.
They would like to know why you say they should not touch it.
And as a parent, you don't want to tell them.
But at times, at the level which they are now,
Yes.
we are in the information age. Don't hide anything for them. Let them know that they can contact a disease from touching that particular thing.
Yes.
Just be straight. Be straight.
Mm.
They are innocent and they are honest. When you told them exactly what will happen if you touch this kind of a thing, they won't touch it.
Mm.
You understand?
Yes.
You don't want to get sick. So most of the time, how do we get this particular problem? It's through our own hygienic nature. Poor hygienic.
Poor hygienic from
they went outside to go and play. When they are coming back, tell them to go to the bedroom or anywhere. Go and wash your hand. Before you touch anything, go and wash your hand.
I've seen that. There are so many families, even sometimes when I watch some movies, you see some white, they'll tell you before you do anything,
wash
off your shoe here, go and wash your hand. It's just like a routine.
It's a culture you must do
in that place.
I learned it somewhere. You understand? But presently now it's working for me. If you walk straight into my house, before you move into the living room, you first go into the visitor's room. Oh. You understand? Yes. That is you. Then you face the low, the gents. Just go in there, wash your hands. As they are coming, you drop your bag, enter here, wash your hand, and let's go in. Whatever you want to do, let's go and do it. Wow. Because they used to collect a lot of things. They even biro. They can contact it through biro. Yes. Through book. Through the service. Maybe one of their friends went to the toilet and is already a carrier. Of course. You understand now? You didn't do the normal washing hand, borrow the pen. Or when the person is coming back, just lay down on put his head on the desk, put it there, put their hand. And they wonder, what's wrong with you? Are you okay? From there, they've already picked that visitor. And when they are coming back home, they give it to you at home too. Of course. You understand? So they are the culprit. We need to be very careful in handling those children. How about adults now? The adults, let's look at Lagos for instance now. We move from buses to buses, collect money from Agberu, buy this, buy that. So then some of our mothers too, they are fond of it. When you give them money, they first put it here. Even the money you put in the mouth, do you know how many people have touched that money? If you want to catch money, instead of you to use your saliva to count the money, it will be advisable for you. Put it down one after the other. If you know you don't want to rush. The money, the buckets you collected, the all those small things you are collecting from people might have been infected unknowingly to you. But when you pick it from outside, before you start eating anything, wash your hands. But most of us in Lagos here, even the person who is going to prepare what you are going to eat, I love Lagos for one thing. It's only in Lagos here that it's quite impossible for you to cook while you're traveling. Yes. You understand? If you pass through my 12, they will give you pepper while you're in traffic. They will give you yam while you're in traffic. They will give you a while you're in traffic. You can prepare everything on the road. You understand? And if you are not careful, you'll be a carrier. Of course. Take it home. We like rushing in this Lagos. And nothing is pushing us. We are the one pushing ourselves. It will be much ideal for you to slow down before you take any step. Wash your hand. You can't undermine that particular act. Always wash your hand. So preferably to avoid this spreading of all these ailments, before you enter your house or anywhere, we should start by washing our hands at all times. With soap, let the soap be there waiting for you. Wash your hand. All right, this is really getting serious now. Sir, also, as much as we're about to go to the next phase, I would like to tell our viewers, please, this is the best time for you to start sending in your questions. Don't wait until the end of the broadcast before you start sending in your questions. We would like to start receiving them so that I can pause at any time to attend to our questions as long as it is there. Please, this is the best time for us to start dropping our questions. So, sir, while we are talking about the causes and how gastroenteritis spread, we've not talked about the symptoms of each and every of this type. We talk about the bacteria,
gastroenteritis, the viral gastroenteritis, what are their symptoms if I'm affected?
All of them have the same symptoms.
Wow.
Majorly 4. Number 1 of it is running stool, diarrhea. You go to the toilet frequently.
Both adult and the younger
Both
ones.
adult and the younger ones.
Okay.
And the only thing you'll be passing out is just the watery stool.
Okay.
But the moment it has a traces of blood, please, it has already gone beyond gastroenteritis. You understand?
Yes, sir.
The next thing that there will be noisy, you'll be noisy. Vomiting. Then stomach cramp
Yes.
will be there.
Okay, sir.
Then light fever. When these things take longer than 2, 3, 4 days, please, you have to see your doctor.
Wow, so that takes us to our next question. That's my fourth question. It says, when should someone seek medical attention, and how can we as a person prevent gastroenteritis in our daily life, especially in a household that are filled with children and frequent visitors? Just like you said, let's say your house is filled with frequent visitors. When exactly should we seek medical attention? And how can we prevent
when
it?
I was defining these viruses in the beginning, I said in adults, it's within 12 to 48 hours of incubation period. That person will know that he has contacted something.
That's right.
You understand? When that thing happens, the first thing they needed to do is that if there's nothing like first aid they can do at home, or ORS they can use, they should go to hospital to go and confirm which
after that 48 hours.
Yes.
You have discovered that
because when you have running stool,
yes, sir.
you understand, and you go to hospital, they will ask you how many times have you gone to toilet.
Of course.
If you say it's 3 times, there's no problem.
But if the 3 times is like frequently, like
within
1 hour,
you ask me which 3 times.
Okay, which 3 times?
Because natural for a normal human being,
yes, sir,
you're supposed to enter that low 3 times in a day.
Wow. 3 times in a day.
The food you eat in the morning must digest it within 24 hours. In the afternoon must digest it within 24 hours. In the evening must digest within 24 hours, which means you must go to the toilet in the morning, afternoon, and evening. But if you cannot do it those 3 times, at least once in a day, you should be able to move your bowel. But once you now go to toilet, you just went that 3 times and nothing happened. Yeah, that's no problem. But when it's more than 3 times and it's now turned to watery, because when there's nothing inside you again, now only water will come out. So it's more than 3 times already, and you have been going there. Then the kind of stool that will be coming out, the odor, though it's watery, but the foul odor will be there.
So the odor will be greater than you stooling on a normal regular way.
Then it will come with pains. It will come with pain. You know, the kind of stool that will be coming out, even before you reach where you want to sit on the closet, the trace has already reached your pants. That's kind of the stool I'm talking about. Because you are already disturbed. The stomach cannot contain that particular virus again. So you'll be pushing it out. You understand? So that is the time you're supposed to go to hospital, seek a medical attention. And for the children, don't wait too long. Their own immune is much stronger than our own.
Yes.
You understand? Our own can happen within 12 to 48 hours.
Yeah.
Their own can be within 2 to 3 days.
Before it can manifest
fully.
Wow.
Because they still have a stronger.
Their immune system is combating this virus.
It will fight it until it will overpower it. Wow. You understand now?
Yes, sir.
So by 2, 3, 4 days, please don't look at it.
So is it that I want to clearly understand this thing. You said for adults between 12 to 48 hours. Yes. Is it that between these 12 to 48 hours, the adult will be stooling already? Or is it that it is after these 12 to 48 hours, the stooling will take effect? And that of the children too. Is it after 2 to 3 days? You know, when the body system takes in this viral loads or this bacterial load, you said it will go through incubation period. So during this incubation period, it is expected for it not to have materialized. Exactly. So is it not that it is after that hour that it has the incubation has happened, then we now start seeing the outcome that's when we should go.
Let me answer this question this way.
Yes, sir.
While you are eating,
Yes.
you understand? Maybe you are eating one of these boiling fish, and something now choke you. Yeah.
Those Japan, yeah.
Now choke you on your tongue. When there is a visitor somewhere, a strange occupant somewhere,
yeah,
your system will tell you,
of course, immediately,
that something that doesn't belong here
is there.
There is something we call commensal. These are bacteria
Exactly.
that are supposed to be inhibited in a particular place. Maybe the down low for the women,
of course,
and your mouth. There are bacteria here.
Yes,
good bacteria here. There are good bacteria here.
Of course.
You understand? Do you know when you are holding plate here and there, you are holding mic? You understand? Those bacteria belong to mouth, and you mistakenly drop them where they are not supposed to be. They will cause havoc there. Of course. And you yourself will use your mouth to pick another bacteria that's not supposed to be in your mouth to your mouth. They are commensal. Because where they are living, you have taken them away from their environment. From their own environment, now into another host. In another host. Yes. Like that thing that we are talking about now, immediately that virus enter your system. Yes, sir. After that 12 hours, you know that you are not yourself again. Something strange is already in your system. But by the time it's manifested fully, around that 40 hours, then it has already taken over. Of course. It's taken over. All right. Before we go ahead, I would like to take this question very briefly from our Instagram page. That's from Tayo Adonipeku. She said, since children are culprits, what are the KEDI products for treating gastroenteritis in children? Wow, that's interesting. Anything to handle related cases that have to do with the stomach, we have two products perfectly for that. Okay. Gastrifort is good for anything stomach. Then we have Constellis that can take care of the stooling and hold it at bay. Okay. So Gastrifort and the Constellis. Yes. So that is for children. Both adults and children. We can only just reduce the dosage for the children. Okay. Anybody from 10 below can use one capsule of Constellis. Okay, my guy. No, we'll still go into this part very soon. So, Mrs. Tayo Adonipeku, just be patient with us. And so, sir, having talked about all these symptoms, how it is being spread, and we also know that there is no way we will not deal with food at all times. No, there's no way. I would like you to tell us, sir, are there specific food that can help or worsen symptoms during the recovery process? Already, I'm recovering from this gastroenteritis now. So, are there specific food that can either help or worsen the case while we are when we are recovering? And how can our networkers, we have networkers here and there, we move from point A to point B, all in the name of this business. So how can networkers who are moving from one town to another protect themselves from gastroenteritis? Thank you so much. There are some. Let me handle the one that can aggravate the problem. Before I go to the one that can suit the problem. When you are having this particular virus, yes, you need to move away from anything that is spicy. Any spicy food, completely. Any dairy food, completely. Spicy dairy food. Please, we can hear. Any spicy food, dairy food, caffeine, beverages, soft drinks. All those ones will aggravate the challenge. So what are we going to eat now? So like me now, I cannot do without taking soft drinks. Let's say I'm not a cardiac now. So what should we do? How can I do it? Mr. Felix. I'm being called that now. If you cannot do away with soft drink, you're on your own. Okay. Why? Or your move. Seriously. Even as a man, you don't need it much. Of course. Yes. You don't need it much. You understand? There are some particular chemical inside those soft drinks that triggers it. I want to go beyond that one now. You understand? It will affect you as a man in your production. 1, 2, it will affect the bone, and we have a depleted bone. That's why most of the time when I see women, that they cannot do anything without, when they eat a little food, they put some drink on top of it. I laugh and I weep for them. Before they reach the age of 40, 50, they'll be having that problem of the bone, arthritis and co. Because there's a particular chemical inside those products.
All those soda drinks.
Oh my God. It takes care of your bone. And when, you know, have you ever seen a decking coming down? A deck house come down. Do you know what will happen to it? The iron bar that hold it
already corroded.
Corroded. You understand? Already corroded. You understand? So that is the problem. So now, the one that can make it easier, for the system, rice is good, but not on high level.
So we can. I don't think we should go to like carbohydrate foods.
I didn't say carbohydrates.
No.
Eat moderately of rice, then fruits and vegetables are good. Green leafy
rice, fruits, or veggies. That's what we can take at that time.
When you are coming out.
But sir, I will still want to ask some question in that part. But before I ask that question, let's attempt to this. You told us to stay away from dairy products and co. What about yogurt? Someone is asking us that. What about yogurt?
You can't take yogurt at that particular time.
At the period whereby we are facing this gastroenteritis,
yogurt at that particular time.
Oh, we should stay away from yogurt too.
Yes.
All right. So that now takes me to my question. You know, you told us to feed on veggies and co, vegetables, fruits in this period. There are sometimes I've noticed when we consume vegetables, we end up running stools and co. And now I'm already running stool. And you want to go and take, let's say I go to one restaurant and I say, give me amala this and vegetable. Wouldn't that still add up to the issue?
Thank you.
Would that not still cause? Because for me now, if I go to some function, I cannot take vegetable because I know it will affect me because I don't know the way it is produced and everything.
You've already answered the question. The one they prepare outside, cannot compare to the one you prepare inside.
But in this period when I'm stooling, I don't think
the one they can prepare for you inside will be more nutritious than the one they prepare for you outside. And when they prepare vegetables for you, I will advise you chew the fibers really. All those veggies very well. Don't just swallow with amala. That's why you normally see them when you are stooling.
Oh, because we did not chew them very well.
Do you know any type of food you hate and you saw it when you are stooling, doesn't pass through digestion?
So it skips the colon part and
whatever that pass through digestion is already in your system. Wow. It won't come out. It's what the body doesn't need.
Exactly, that comes out normal. This is amazing. So each time we see it, so which means that particular food item has skipped the digesting
normal procedure.
How?
I'm not God. You understand? So I want to go back to another question you asked.
Exactly.
About our networkers that move from one place to the other.
Exactly. You need to make money. Get business. How can they? And they must eat too in those places they are going.
I'm a grassroots networker.
So sad.
And I travel a lot. When I'm outside, living my comfort zone, you understand? I behave like them. Those environments which I find myself. I eat whatever they are eating.
Okay, sir.
But I'm always careful. When I go to the way I wanted to eat, I do the washing.
Okay.
I wash both my hands. And when I'm finishing, I wash both my hands. Okay. Then I don't just pick any spoon to eat. Whatever I think I'm not sure of this spoon, I won't use it. I will rather pick a spoon, go and wash myself, then come back and eat.
How about the plates they used to serve you?
I'm not sure about the plate. You understand? Yes, because I'm not the one that wash it. Maybe I'm the one to pick the place and go and eat it, then I'll wash it myself.
So you do this due diligence every time?
Because at times I can be outside my environment for the next 6 months.
Of course.
And my head there will determine my success there. Of course. So how would I foresee? Won't be the only. I must not foresee.
Wow.
So what I went there to do must be actualized. Of course. It's number one thing in my mind. So that is it.
So your major advice to networkers now, how can
They just need to be careful.
Okay.
We can't underemphasize the idea of washing your hand. Perfect hygienic nature. You need it. Both in your home and outside. You need it.
So all our message is to preach on hygienicity at all
It's
times.
very, very important. No, there are some times I travel to the other side. And if you are not careful well enough,
because
you pick a lot of things.
Aha, thank you, sir.
You understand?
Because they are one of the major concerns.
You pick a lot of things along the line. You understand? Because I was there for 6 months, even more than 6 months, sir. And I came back. Oh, not sick. But if you are not careful, I keep saying that word, if you are not careful, if you are too reckless, you will sick.
So is there any food you can possibly tell us in such a situation? Like take for yourself, for instance, what kind of food can we be eating? Should I just go out? Should I be buying all these snacks?
Whenever you see, any place you see that it is too inviting to the flies, be careful.
Because they'll be transferring a lot of pathogens, lot of all these low viruses. All right, sir. So moving on, that takes me to my last question, sir. As a renowned TCM consultant with many years of experience, which KEDI products do you recommend for someone dealing with gastroenteritis, and how effective has this product been in treating this ailment?
We have about 3 products I can use.
Okay.
And I can tell you 100%.
Your full chest.
Now me today, they are not be born.
All right.
Our product can handle it. Reishi, if the virus load is too much,
okay.
Reishi will help.
Okay, sir.
Constellis and Gastroenteritis.
What is the dosage rate of each of these?
For the keys, as I've said earlier,
yes.
If it is Constellis, instead of taking 2, they take 1.
Okay.
Gastrofor, they can take 2 instead of 3. But for the adults, and Reishi too, they can take 2.
Please, sir, let's be specific. Which age range of these children?
Anyone from 5 downward,
okay,
can take all those products 1 instead of 2.
Okay, the 3 products.
The 3 products 1.
Okay.
Then they are not going to be used together. We have a way of using our product. You space them. There are some that are before food. There are some that are after food. Okay. But these 3 products I mentioned now, one can be taken after food or before food. That is Gastrofor. It depends on what the person is passing through. Like this situation now, child is passing through. Yes, like this situation now, you can take that Gastrofor after food. Okay. You understand now? Yes, why Reishi and constantly be taken before meal? You understand? So Reishi can be taken first. 30 minutes later, you take Constellis, and 30 minutes later they can eat. Okay. But anybody from 5 upward.
But how would a small child use those product the way it is? Is it that the parent needs to open it, dissolve it for the child?
If they are less than 2 years,
yes.
Pour it in, open it, open the gelatin and pour it in the spoon for them. Okay. But if anybody from 3 can swallow.
Okay.
And they cannot swallow it, ordinarily put it inside their food, they will swallow it. Okay. They eat them.
Exactly.
You understand? Right. So they can take it. Then anyone from 5 upward to 9. Yes, sir. You understand now? They can take Constellis 1 capsule. Others 2. Okay. You understand? But from 10 upward, they are more or less like an adult. They can do the same thing that we are doing. Okay. Because I've seen a girl of 10 years being impregnated. That's story for another day.
This is
so they are more or less like an adult.
10 years. So puberty rate
that's changed.
No longer between 14 to 15 again.
No.
Wow. This is very, very great. So, Sam, with the use of this product, you are very confident that anybody that's battling with gastroenteritis are going to
100%. But we can never underplay the role of hygiene.
Okay, all right. So, indeed, this has been a great and inciting edition. Many of us have learned about gastroenteritis and how it looks like. So, there is a question here, which is that a lecturer once said it's not good to swallow drugs. with food. And we are talking about when we want to treat gastroenteritis, sometimes for some age or for some children, from persons, they can swallow it with food. I would like you, sir, to share your insight. Is this statement true? Swallowing
To some
food
extent, it's true.
with.
You understand?
Okay.
There are some occasions whereby those people are on the sick bed. As a healthcare practitioner, you have to use your means of how to make sure that this particular product get to their system.
To the body system.
You understand?
Yes, sir.
There are some that cannot even take it orally.
Of course.
You find me.
You have to ingest it into the
Yes. Though we don't have injection now
in line
in our own line of products. You understand? I'm just using that on the top.
Yes.
But now, with that kind of a person that say it is not ideal, it may be right. And it's right to some extent.
Yes, sir.
Because when you are talking about digestion, a lot of things happen. So we can find a means on how to make sure that the person take it without the food. Like what I said, now some of the product can be taken, will have to be taken before meal.
Exactly.
You understand?
Automatically, so, it's without the food.
You have to make sure you.
But what type of is it true with drinks or what should they use it with at that time? There's some people that will use 7-Up. They want to use 7-Up.
No. You know, I told you when you are passing through this particular ailment with this virus, don't take anything soft.
Yes, anything soda.
Don't take anything soft. Don't move closer to it because you're not
only for this ailment.
Not only for this ailment.
Because
anytime you want to use drugs,
yes,
don't use soft drink. Don't use tea.
Any ailment or something.
Any ailment. Don't use tea.
Because I've seen instances of people. Let's divert a bit. People that are battling with, let's say, malaria infection and cold. You see them using 7-Up. But no, they use it to do agbo.
No. Let me tell you something. Where you are going to, you cannot finish it. Okay. You understand?
Yes, sir.
Let me tell you. Okay, let me sub it for you like this.
Okay, let's do that.
What they use to prepare it is not as important as the effectiveness of what they want to use.
Okay.
Do you know that if they use ordinary water to prepare that, it's going to work better?
But why are they not using something to prepare it?
It's just a carrier.
Jehovah.
They are looking for means of something, softer carrier that cannot disturb that particular person.
To make it palatable for the person to consume.
Yes. That's about this coughings. Sorry to mention the name of any product. Any cough syrup they normally produce. You always make sure that it's sweet for the children. Anything you want to give to the children must be sugary. That's the only way to attract them to use it.
So that the drugs can be ingested into the body system. Wow.
Well, those who are now using something to do that particular herbs we are talking about,
yes, sir.
They are looking for means to make it easier for those who want to consume it to be attracted.
Okay. Wow, this is really
because whatever you use that particular thing for, even if it's hot drinks,
sometimes hot.
If you use ordinary water, it will work.
But
they are just carrier.
Hope all those things will not bring down the potency of
it. Will never bring it down.
Okay.
I'm telling you. If you want to talk about this TCM, I'm fast. If you want to talk about our own, I'm fast.
Wow. Let's give it up our one and only amiable Mr. KENNY ADEYEMI. Indeed, we have heard a lot about gastroenteritis and its causes, prevention and treatment. It's time for me to take more of our questions as I've been taking it in between our program. So another question right now is that from Chikeze Grace on our Facebook page. She's saying that from your wealth of experience, how do you detect this ailment with quantum machine? You know, we are so much used to quantum machine at all times. So how can we detect it, Mr.?
What the quantum machine can do, every device has their own limitation.
Yes, sir.
You understand? Yes, sir. You know, for that person to hold the rod self, will make that rod a carrier.
So this is amazing.
You understand?
I get it, sir.
You cannot use quantum machine to detect the virus.
Exactly.
Gastroenteritis, you cannot use quantum machine to detect it. You know, there are some things you need to be professional about. When you are asking questions and they have been telling you that the person is running through, you know, we normally do consultation before we do test. If the person is running through, it's already warning for you, red flag for you that the person should not hold the quantum rod. But the moment they hold the quantum rod, you as the person that want to collect the quantum rod,
you might have been infected because it will be transferred to you.
You understand? The quantum rod or the quantum machine as a cannot detect gastroenteritis. Okay. But through your consultation with them, if you're able to get what they are saying, you can treat them. If you want them to go for further tests, refer them to the lab. Okay. They will go there, do the test, and bring the results. Yeah. You understand?
So, Mrs. Chikize Grace, I've heard it all from our guy. He says a quantum machine cannot be used to detect gastroenteritis. Please, in case, just follow through with the consultation. And in case you need further clarity, just refer the person to take proper lab test and bring the result to you for you to be able to give your medical advice to that person. You can just tune in. This is still Talk to KEDI, and our guest, Mr. KEHINDE Adeyemi, has exhaustively discussed gastroenteritis, its causes, prevention, and treatment. Thank you so much for tuning in. We'll leave you with our Dr. Cap Eti for today. Well, Mr. KENNY Adeyemi, over to you to read for us our Dr. Cap Eti for today.
Prevent gastroenteritis by washing your hands, drinking clean water, and eating properly cooked food. Eat a balanced diet, get enough rest, and stay hydrated with ORS. Remember to always seek medical help if symptoms persist, and treat gastroenteritis with our specially formed KEDI products.
You have heard it from Mr. KENNY Adeyemi. He said what? Always ensure to seek medical help, and peradventure you are not still comfortable. Always make use of our specially formulated KEDI product. With this, it is a wrap on this edition of Talk to KEDI. I hope you have learned something valuable today about gastroenteritis, its causes, prevention, and treatment. Special thanks to our wonderful guest, Mr. KEHINDE Adeyemi, for taking time to share with us from your wealth of knowledge. Your final words, sir.
Thank you so much for having me. Dear viewers, you can't do it all alone. Whatever you find yourself, try to be hygienic. Wash your hands always. Ask questions when you needed to be asked. Please, where can I wash my hand? Wash your hand. Then join the crowd.
Thank you, sir. In case you join the broadcast late, don't worry. The full video will be available on our Facebook page at KEDI Healthcare Industries, on our Instagram handle at KEDI Healthcare_official, on our YouTube channel at KEDI Healthcare, and our mobile application KEDI Care app. Feel free to watch and share with your loved ones. Don't forget to join us in the next edition of Talk to KEDI, because it promises to be insightful. Thank you so much for tuning in. Until I come your way next time. Bye for now.